I've been waiting for this moment for ages, Dr. Seshni. It's been such a long time. I'm in the studio now, Dr. Seshni, as you can clearly see on Zoom.
I know. Good morning, and happy Easter to you.
Good morning. Happy Easter to you, Dr. Seshni. Happy Easter to you and your family. And I know you miss coming to the studio, especially you miss this, don't you?
I do. Yes, our morning coffees.
All right.
I've got.
So you can go watch us live on Facebook on my page, and also, you got yours as well. Can I see your cup?
Oh, it was a happy birthday month from one of the nurses at work. It's so precious. I love it.
That's fantastic. It's beautiful.
Thank you.
So you can watch us live on Facebook, on my page, and of course on the Hospital Radio Bedford page, and on Dr. Seshni's page as well. And as you know, Dr. Seshni comes here, and all we talk about, mainly, is health. What's going on in the country and all that. Good morning once again, Dr. Seshni, and welcome.
Good morning, and I hope I can
break.
Good morning. Thank you for having me, Opoku. It's been ages, and as you've been waiting, I've been waiting so long as well. So I hope I can join you in the studio one of the days.
You must. In fact, Jeff White, who was just saying that, Dr. Seshni, you need to come back to the studio. You need to come back to the studio.
Tell Jeff, definitely. I'm definitely joining you guys. And it'll be lovely to be in the studio. It's a different feeling, isn't it? But yes, with COVID, we can talk a bit about, what's been the latest update. There actually isn't that much news, to be honest. But let's.
There's not much, but there's a couple of stories. Anyway, I'd like to let you know if it is the first time you're tuning in, or if you haven't tuned in for a long time. I'd like to let you know that Dr. Seshni and we've been updating the nation and the whole world on the COVID situation here in the United Kingdom and all around the world from the 2nd of February. Is it 2020, Dr. Seshni?
Yes, 2nd of Feb 2020, we started broadcasting about COVID-19.
Yeah. Amazing. Now, Dr. Seshni, more than 10,000 people who signed up to help deliver COVID-19 vaccinations have now taken permanent roles with the NHS in England. Let's start on this lighter side. About 71,000 people took paid roles, and thousands more volunteered to help with the program, which has now given more than 120 million doses. What says on this one, Dr. Seshni?
Yeah, so I think that's it's really good news, I would say, in terms of obviously people that were obviously vaccinating and helping out with the rollout of the vaccine, that now they've been given in permanent roles. And I think it's important to be, to recognize them and to know that, they've, as you said, they've rolled out 120 million doses. So I think making them sort of permanent in the NHS is important, because obviously all the people, when we used to go even for our vaccines and when we took the kids, it was all volunteers, and they were also helpful, really good, and made the whole process, really smooth. And I think the fact that they've now, these 10,000 now have signed up to deliver vaccines, have now taken up permanent roles. I think it's good news. I'm not sure what you thought of that.
I think it's great news. I really think it's great news. At least, you volunteer to do a good job, and then later on you benefit from it, like getting signed on and getting paid for it. I think it's amazing. It's brilliant.
It is. And I think the other thing is also the vaccines have played such an important role. I mean, we've always been talking about it, and we've said disclaimers. Obviously, people need to take on board the most up-to-date advice about vaccines. But we know for a fact that the evidence is there. There's enough evidence that they've completed with different studies globally, where they've shown that taking the vaccine, the first, the second, and then the booster has definitely helped reduce the effect of when you do contract COVID-19 or the risk as well. So it has helped. Personally, I know it's helped my patients, obviously can't discuss confidential information, but I've seen for myself people that I've spoken to, colleagues, patients, and carers, that having had the vaccine, there's enough evidence to suggest that it has helped. And again, so these people, the volunteers, they've been a more important part in rolling out the vaccines. So if it wasn't for them, it would have been really difficult to have the successful rollout that we've had in the UK.
Yeah, that's great. And talking about the effect of the vaccine, of course, there's so many other factors, but mainly because there's been a lot of vaccinations.
Yes.
The news story here is that the number of people in the UK infected with coronavirus is falling. And that is from the Office of National Statistics, the ONS. About 4.4 million people had the virus in their body in the week up to 9th of April, down from 4.9 million the week before. That's about 1 in 15 people testing positive for the virus. And the thing is, the study, which uses its own testing, gives the clearest indication of the virus spread since free testing ended in England. So it's good news, really, isn't it? So it's because it's falling, it's dropping down. Yeah.
That is the latest figures and the graphs that they've had. If anyone's interested, you can go onto the ONS, ons.gov.uk, and they give you statistics. But as you've said, that they're saying the percentage of people testing positive for coronavirus have fallen from record high levels in England. So that was from the 9th of April. So definitely, and it continues to fall. So they're saying that, they've given a whole lot of numbers, but they're saying overall the numbers are falling, which is great news. And they're also saying, obviously the ONS is involved in other studies. So they're looking at suicide as well. So just to mention, they're saying that no evidence that suicides increased during the COVID-19 pandemic, which is, for me as a psychiatrist, that is something that I would have been concerned about. And obviously people, because of being in isolation and the post-COVID effects. But according to ONS, they've done that. So I think, as you were saying, it seems that the figures are falling. And they're also saying that most people in the UK who have reported to have been vaccinated continue to be less likely to test positive for the virus than those who reported to be not vaccinated. So this was in the last 2 weeks from the end of March. So that's also something positive, isn't it? So if you're vaccinated, it's more likely you will test negative. But if you're unvaccinated, it's more likely that you will test positive.
Right. We will talk about some travel restrictions being lifted, but we're not some. Probably all travel restrictions have been lifted, except probably for wearing your masks on or your mask on the airplane. We'll talk about that later. But first of all, let's talk about this situation where I think this is me. I don't know about you, but it feels as if we are living with it now. We are facing it, and we are not fearing it anymore. It's like when you go up and about, like in the shops, and like some people do still wear their masks and all that, but there's not that fear anymore. There's not that phobia, as you wrote about in your book. People just walk about. You remember in those days, in the first quarter of 2020, when you would be walking on this side of the street and you see somebody and then you cross up to the other side. It's no more like that. People are handshaking and everything now, and they're not fearing it. Do you feel that's the situation now?
It is. It definitely feels like that. I think we've returned to the new normal, as we would say, Opoku. And as you've just rightly put it, we are not fearing it, we're facing it, and we're living with it. So when you go out to restaurants, or you go out shopping, or you're going on the trains and traveling, people are not as I would say, they don't have that coronaphobia, yes, as I wrote about. So the coronaphobia doesn't seem to be that. I think primarily it's about the fact that we know that the vaccines have helped us, and most people by now have been vaccinated. So I think, to be honest, I don't know how you feel, but I think most people, once they started to get the vaccines, they felt a lot more confident. I mean, a lot of people started, getting into the new normal very early on, even, as soon as they got the vaccines. I think some people have waited till they've seen the effects of the vaccines in each of the countries. Like, for example, in the UK, we've waited to see how it actually panned out, what was the effect of the mass vaccine rollout. But I think people have definitely, there's a lot less anxiety. And especially now that the weather's improved, I was just telling Ferdinand, I said, people seem so much happier. Like over this Easter weekend, you could just see people are so much happier. The weather's improved. We don't have that many COVID cases. I mean, we're still getting people testing positive, but the effects are not bad as what they would have been if people were not vaccinated. So yes, people are just living with it and continuing normal. They're traveling, they're going out to families, and they're not they like as you described, they're hugging each other, they're shaking hands, so there is that bit of social contact. Because for a long time we were not able to do any of that.
No, not at all. I mean, it's not for me. It's not in my place to tell someone to go and get vaccinated or not. But we can only advise, can't we, according to the information that we have. But I must say that the vaccination rollout is making, like you said, and that is making people a bit more confident, and is making people not fear it as much. And also, when people test positive, the effect is not as bad as it used to be. Like I remember we used to talk about this every day on this show, where we talk about the fact that there's so and so number of people in intensive care and this and that. We hardly hear that these days, do we?
We don't, and it's because it's reduced. So it's reduced the effect of the transmission of COVID-19. It's reduced the chances of spreading from person to person. It's reduced the morbidity and mortality from getting COVID-19. So people that have been vaccinated, even if they did test positive, the symptoms are definitely much less and self-limiting. And also, like you pointed out now about the hospitalizations and ICU, it's reduced the burden on the NHS and in hospitalizations and people ending up in ICU and in general hospital for COVID admissions, because at a few times in the last 2 years, we've had significant periods where people were being admitted, and some of them in ITU. Boris Johnson was admitted to ICU when he did very early on in the pandemic. So it was quite serious. But it's good to reflect, isn't it? It feels like we're reflecting 2 years on that, how things, almost 2 years on, how things have changed. Yeah.
Yeah, things have really changed, haven't they? Now let's talk about the travel. Fortunately for us in the UK, almost all travel restrictions have been lifted, except for mainly for people who have had full vaccination. Like if you've had, and I think a full vaccination is considered as having at least 2 jabs, isn't it?
Yeah.
So if you're going to come into the UK from wherever and you're fully vaccinated, you don't need what do you call that thing? Pre-flight COVID PCR test. You don't need that. Yeah. And you don't need to fill in a passenger locator form. And you don't need a day 2 test when you get day 2, day 5, day 10, whatever test. You don't need it. Except if you're not fully vaccinated, then you would need a pre-flight COVID test. And even that, it doesn't have to be PCR, does it? You can do an antigen test, and then when you get here, you do a day 2 test. So things are changing, except for certain other countries. Some countries are still holding on to these things, but they're changing bit by bit. You've just come back from where did you go? Qatar or Dubai or somewhere?
Yeah, Qatar in India. Yeah, it was.
Or you went to Qatar and India. What's the situation like there in those countries that you visited, as compared to what's going on in the UK in terms of travel restrictions?
Yeah, so there's a bit of difference, as you pointed out, Opoku. So I had to transit at Doha. Doha, they expected
Yeah.
you to have your COVID vaccine evidence. If you didn't have that, then you needed to do a test. And then the people were, I think the situation in Doha is quite good in terms of the way they're managing it. In India, again, they didn't need a test unless I hadn't had the vaccine. So my sister flew. My twin sister, we landed together in Doha on our birthday, and we flew together to Bangalore in India, and she needed to do the testing. So even though she's been fully vaccinated coming from South Africa, to enter India and Doha, she had to have her vaccines. The COVID testing.
So it depends on what country you're coming from.
So it's still very different because she had to do her 24-hour test. So she had to do the PCR test. I didn't have to do it, and I went through India. We had a wonderful sort of a pilgrimage to the Ganges to take my mom's ashes, and obviously enjoy a bit of the India as well. And the situation in India, the COVID, I mean, everyone's wearing masks. There's very strict guidance. And people, I mean, at the airports, it's really, when you go to the UK airport, sometimes it feels quite stressful, but in India, it was really, really easy. It didn't feel stressful at all. People were just adhering to guidance. Everything just went smoothly, in terms of, getting through and having evidence of your vaccines or having your PCR tests. I think even at airports like Heathrow, at Bangalore, there was a test center, so you could just get tested at the airport and get your results. So I think most places are like that now, Poku. It's most, like you said, there's restrictions with some countries, but most countries now, like with UK, if you are traveling to other countries, you just need your vaccinations. You don't need the PCR test or the antigen testing when you go and when you come back.
Did you have to get a test at the airport in Bangalore?
No, not to me. No, Sanusha didn't as well, my twin. But when she had to return, she had to provide evidence of her testing. Yeah, and vaccination. Yeah, but no.
Okay. But I've also just come back from West Africa, and
yes, you were traveling at the same time. We were traveling.
It was slightly different. But now it's changed a bit. I flew into Ghana, but then I had to get the test at the airport. Everybody gets a test, and then I went to Nigeria the next day, and I needed, in spite of your vaccination passport, you still need an antigen test at the airport. But then I flew into Nigeria the next day, and I needed to pay for a day 2 test in Nigeria. So, but there was no test at the airport, so I just, got it. And then 6 days later, I flew back into Ghana, and I had to do the test again. I was so mad. I was mad. I was thinking it's just a money-making thing. But the good news is, a couple of days after I had arrived in the UK, the government of Ghana cancelled that test from, at the airport. The airport test, they cancelled it if you're fully vaccinated. So that's good. At least some money, to save some money there.
Yes. It was so, when I've traveled, I haven't needed to test. Well, this was the first, big flight, but I can imagine, having to do so many tests and with a large family.
It's not even the test, Dr. Seshni. It's the money you pay for it.
I can imagine.
It's just crazy. It's just crazy. If you're traveling on a foreign passport, then you have to pay $150 at the airport. If you're traveling on an African passport, then you pay $50. $50 is still a lot of money,
Yeah.
And then I had to do that twice. I had to go to Nigeria, pay £78 to do the day 2 test in Nigeria, and then come back and pay. It's just crazy. It's crazy.
And that's quite a bit. That's quite a bit additional on top of your other traveling expenses.
Yes, it's not as bad as when I went last year in May, because that was a lot of money. You remember we had to pay £210 to get back into the UK, and plus the other ones that you pay. But hey, it's all done now. So it's all finished now. So we can travel in peace now.
Well, that's great news.
Yeah.
That is great news. And I'm, it just shows you how different countries have different rules and regulations. But yeah, exactly. And then, but looking, to the future, I think what's going to happen is like now they've changed the rules again. So I think most countries it will be a matter that you will need your NHS, the NHS app downloaded, and you'd need the COVID pass. So I think that's what the advice would be.
Yeah.
It's simple. You just download the NHS app if you've had your vaccines. You automatically get your COVID vaccines passes on there, and that you can provide as evidence. So I think most places now will just accept that, Opoku. Other countries, yes, a lot of other countries were still requiring people to do testing, but I think as we move along in the rest of the year, I think we're probably going to be doing away with it. I think most people will have to just show their passes. In terms of testing for people that don't have the vaccine, I think that will continue, I think.
Yeah, yeah.
If you don't have...
I think that will. I believe so too. I believe that will continue. If you don't have the COVID passport, then you would have to still do some tests here and there, and it's also, I was thinking, even though we, like, for example, in Africa, I went to a few countries in Africa, and the COVID situation there in these countries is almost like non-existent. We know the COVID situations now, like people testing positive, but it's not a lot at all. And I don't know if it's because people were or still are quite serious about restrictions, because they are, people wear masks and all that. You get taxi, and the first thing the taxi driver tells you or asks you, have you got a mask, sir? If you don't, I'll give you one. That kind of thing. So...
And that's great. That's great. To be honest,
it's great. It's quite encouraging. Yeah.
Ghana and Nigeria, they've all done really well. And I think it's because they had good restrictions from the beginning. I remember you said once when you first went, and then, they were checking your temperatures everywhere you went.
If you go into the bank hall, they'll take your temperature right there in front of the bank hall, and before you go in, if you don't have a mask, they give you one. And you remember I told you about me. I was traveling from Accra to Lome, which is in Togo, and I was so thirsty, and I said to the driver, "Can I go and get some water from the petrol station?" I got to the petrol station. And I was going into the shop, and then the lady was behind the glass, said to me, mask, and she said to me, I'm sorry, I can't let you unless you wear a mask. And I said, oh, I left my mask in the car, and she gave me one.
But even India was the same. We were at Sai Baba Ashram in Sri Satya Sai district, where I was last time when we did the live broadcast from India. So I went again there as well after the Ganges, and even there, there were lots of people attending the ashram and the service for Sai Baba, but in Puttaparthi. But even there, they had restrictions. We had to wear masks. They would not allow you. And they also have very strict timings when you can actually enter. People that are not living on the site have to leave, immediately after the bhajans, the singing. So everywhere was really strict. And all over that you went, even though India is quite densely populated, I imagine, like Ghana and Nigeria, there's obviously a lot of people, but still people are adhering to guidance, wherever you go. And COVID didn't seem to be a huge problem in India, following on from when we first heard about, earlier on when they had the Kumbh Mela and, the outbreak in India. But things were much better. And I think also because people have the resources. And again, when I spoke to people in India about COVID, I think they all were really happy because everyone, whatever sort of status or, from the there's obviously a huge divide in India and the population, but everyone has been vaccinated. So I think this is where most people, when I spoke to them, they were saying, it's because they've been vaccination. And, India had large supplies of the vaccines. They were supplying other countries. So they've done very well with the vaccine rollout. And I think that is why India's done, the people feel confident.
Yeah, talking about the vaccines, I just almost forgot, but now I have remembered. A new COVID vaccine has been approved for use in the UK by regulators, and it's manufactured by Valneva, using more traditional technologies similar to how polio and flu shots are made. Have you heard about this, and what do you think?
So it's so it is a new one, right? So
Yeah,
it's obviously been um, approved by so it becomes the sixth COVID vaccine to be granted MHRA regulations, and it's used for adults under 50. So I think this is what they're saying. So, and they've actually, so Valneva is the company, is it? Or the name of the vaccine is called Valneva, and so it's been granted, but it's conditional marketing authorization for people aged 18 to 50, with the first and second doses to be taken 28 days apart. I wonder why it's not for people over 50.
I wonder why. We'll have to ask experts then.
Yeah.
All right. Okay.
So that's interesting, though. Well, we're probably going to see more and more of this, Opoku, because obviously, as you know, with the COVID vaccine, we know that we have to have, so there's going to be like how we had the flu vaccine. We've spoken about this. We're probably going to have the fourth and the the other vaccines like the boosters. So we know that the boosters currently in hospitals, people are being offered the boosters as well. So yeah.
Okay, should we just do the numbers, because I think we only got 4 minutes to go, and then we'll crack on.
Yeah.
So have you got your worldometer?
Yeah, I've just got it on. Yeah, I do have it on. So the coronavirus cases as of the 18th of April 2022, it's 504,828,556 positive cases. Total number of deaths 6,223,531 deaths. So quite a large number of deaths. Total recovered is 456,041,180 recovered. So quite a large number. So in terms of the top 5 countries, it remains the same, with USA number 1 with 82,316,348 positive cases. Total number of deaths 1,015,451. Number 2 in India is number 2 with 43,044,280 positive cases, with 521,965 deaths. So India's number 2. Brazil number 3 with 30,252,618 positive cases, with 662,011 deaths. So quite so more than India actually. More than India. And France is number 4 with 27,771,024 positive cases, with 144,157 deaths. And Germany is number 5 with
number 5.
Yes, so that's a bit of a surprise, with 21,438,293 positive cases, with 133,429 deaths. And UK number 6 with 21 million. So not far from Germany.
Not far from Germany.
Yeah. So 21,747,638 positive cases, with 171,396 deaths. So yeah, UK is obviously number 6. South Africa's number 20.
South Africa's number 29.
So they've moved. They've done really well. So I think they've
done really. South Africa's done well, very well.
They're just living with it. But they've had recent floods, which was quite tragic. but hopefully people will recover. So in South Africa, 29 with 3,741,230 positive cases, with 100,147 deaths.
So we check out where Nigeria is.
Yes, we can. Yeah.
Nigeria is 100 and something. Where is Nigeria? Oh, 102.
Yeah.
On the list.
Got it. So 102 on the list, 255,000 with 648 Nigeria, with 3,143 deaths. So they've done very well.
Very well, yeah.
That is
and
just
Ghana
amazing.
Is gone all the way down to 116.
I see that, yeah. So 160.
Yeah, well done.
Well done to Ghana and to Nigeria, with 161,101 positive cases, with 1,445 deaths. It must be amazing to visit countries like that where it feels like it was almost non-existent. They've just done so well.
Yeah.
It's just amazing. Yeah. I'm sure traveling to the countries, you feel so safe. It doesn't feel.
Yeah, I do feel safe. Feel safe.
Yeah.
Feel really safe. And the people adhere to the rules. Sorry about that.
Yeah.
So yeah. They're quite strict with these things, so at least you feel safe.
It's amazing.
Anyway, thank you very much.
Just the
Seshni.
Yeah, just 24-hour update. Sorry, Opoku. So in the last 24 hours, we've had.
Oh yeah, that's true. Yeah.
So 19,950 new cases,
and
figure is 350 new deaths.
Wow.
And the day before was 31,543 new cases with 651 new deaths. So we'll probably just need to keep an eye on the figures, but it seems like everything's a lot more positive.
One day we'll get there. Zero reports, 0 positive cases, 0 deaths. We'll get there.
Exactly, we will, definitely. But thank you very much. Have a lovely rest of your Easter and enjoy the rest of the celebrations. Hope your daughter had a lovely birthday.
Yes, she did. Okay. She did. And I hope you had a lovely birthday with your twin sister. I spoke to you on that day.
You did call me. Yeah. That was amazing. Yeah. Thank you so much.
Anyway. Yeah. All right. God bless Dr. Seshni, and we'll see you very soon.
Okay. Thanks, Opoku. Okay. Lots of love to everyone. Bye. Bye-bye.
Dr. Seshni Moodley.